Long before modern hospitals spread across the globe, complex medical knowledge already existed in Africa, quietly practiced, rarely credited, and often misunderstood. Today, we explore one of the most remarkable medical accounts ever recorded, 19th-century European observers documenting Ugandan surgeons performing successful Caesarean sections using anesthesia and antiseptic techniques. Before we begin, subscribe to the Endless Archive and turn on your post notifications for future videos like this. Let's step into a story that rewrites what many think they know about medical history. In the late 1800s, the Kingdom of Banyoro and the Baganda Kingdom were among the most organized societies in East Africa. These were not isolated communities, but structured states with systems of governance, skilled craftsmanship, and deep scientific traditions passed down through generations. Medicine in these societies combined observation, experimentation, and herbal knowledge. Surgeons were specialists trained through apprenticeships and guided by communal responsibility. It was within this context that European doctors and missionaries encountered something they did not expect. In 1879, a British medical officer named Robert Falcon documented a surgical procedure he witnessed in Banyoro. What he observed challenged everything Europe believed about African medicine. A woman undergoing a Caesarean section was given alcohol-based anesthesia to dull pain. The surgeon washed his hands and the patient's abdomen with banana wine and antiseptic practice. This was not chaos or guesswork. It was deliberate, systematic, and confident. The incision was made with precision. Assistants restrained movement, while another monitored bleeding using cauterization. After the baby was delivered safely, the uterus was carefully managed, and the abdominal wound was closed using iron needles and bark cloth sutures. The patient was kept warm, monitored, and treated postoperatively. Both the mother and child survived, at a time when Caesarean sections in Europe often resulted in death. This African procedure demonstrated advanced surgical understanding. Perhaps most striking was the use of anesthesia and infection control. Decades before these methods became standard in European hospitals, banana wine functioned as a disinfectant. Heat cauterization reduced bleeding. The surgical environment was controlled. These techniques reveal an empirical medical system rooted in experience, not superstition. Despite being documented in European medical journals, these findings were largely dismissed or minimized. Colonial ideology could not accept that advanced science existed outside Europe. Acknowledging African innovation threatened the narrative of superiority used to justify domination. As a result, African medical achievements were excluded from textbooks and global recognition. The story of surgery in 19th-century Uganda is not an anomaly. It is a reminder. Africa was not waiting to be taught science. It was practicing it. By revisiting these truths, we restore dignity to forgotten knowledge and honor the generations who advanced humanity in silence. As we close, subscribe to the Endless Archive and turn on your post notifications for future videos like this.